Okay, just checking. We're not starting yet. Just want to just do a mic check. Thank you. Hafide and welcome everyone today to today's Proclamation signing ceremony. We are delighted to have you here with us today, proclaiming January 2026 as World Leprosy Month and Sunday, January 25th, 2026 as World Leprosy Day. At this time, I would like to recognize the Honorable Lourdes A. Leon Guerrero, Governor of Guam. Teresa C. Ariola, Director of Department of Public Health and Social Services. Senator Amanda Shelton, former Senators Amanda Shelton, Deputy Director of Guam Department of Public Health, Social Services. Catherine P. Ankau, Chief Public Health Officer, Division of Public Health. Clayton Elisar, Foreign Service Officer of Federated States Micronesia. Chima Mbakwen, Program Manager, TB Hansen's Division, Bureau of Communicable Disease Control, DPHSS. Emmeline Casilo, Admin Office of Filipino Consulate. Art San Augustine, Special Advisor, Office of the Governor. Okay, at this time I'll recognize the Director, Teresa C. Ariola.
Thank you, Senator. Thank you, Governor. I know your schedule today is like back to back, so we appreciate you taking the time to being here with us today. Buenas, good afternoon, everyone. Biba Betnes, it's Friday. I don't know, but every day this January seemed like a Monday, if you understand what I mean. So thank you, everybody, for coming. I'm pleased to welcome all of you and the staff from the Guam Department of Public Health and Social Services to this event today, World Leprosy Day and Leprosy Awareness Month. This event is observed worldwide on the last Sunday of January. So this weekend is last Sunday. It was established in 1954 by French journalist and activist Raoul Fleur to honor the death anniversary of Mahatma Gandhi on January 30th, 1948. The theme for World Leprosy Day 2026 is Leprosy is Curable, the real challenge is stigma. This serves as a call to action to raise awareness of leprosy, highlight the challenges faced by individuals affected by leprosy, and encourage collaborative efforts to eliminate it once and for all. As we observe World Leprosy Day, please remember those who are affected by leprosy. For many, stigma remains one of the most significant challenges they encounter. Stigma impacts their daily life of those affected, depriving them of livelihoods and leaving them without work or income. It can force people from their homes, separate them from family and community support, and deny children access to education. The stigma around leprosy grows from deep roots of fear, misinformation, and long-standing injustice. We can break this cycle by sharing knowledge about leprosy, standing in solidarity with people affected by leprosy, creating opportunities for work, and championing human rights. It is crucial to remind everyone here today that people cured of leprosy are not contagious and can flourish like anyone else. Embracing them in our communities and changing old laws are important steps towards eliminating leprosy. Above all, giving a platform to those affected so they can tell their own stories is a powerful force for change. Today, we will hear from Mr. Amar, a leprosy survivor from Nepal, who will share his experience living with leprosy. As we all know, early detection and treatment have helped reduce disabilities caused by leprosy worldwide. The involvement and advocacy of people affected by leprosy have also helped lower stigma and discrimination in our societies. Today, as we look to our current situation and future plans in Guam, I am happy to share again that we have created the Guam Path to Zero Leprosy Roadmap 2024 to 2030. This plan was developed with input from local and international partners, including, of course, the Department of Public Health and Social Services, led by our very own Chima and his wonderful staff, in Global Partnership for Zero Leprosy, Total Guam Foundation, and other stakeholders in the room. I want to acknowledge Department of Education and as well as GMH that joined us today. We are the first in the Western Pacific to achieve this. The first. Our Zero Disease, Zero Disability, and Zero Stigma Action Plan aligns with the World Health Organization Neglected Tropical Disease Roadmap 2020-30. We did not stop there. I have also participated in global discussions with international partners regarding Guam's involvement in a pilot program to develop a urine-based test for leprosy identification. This test could significantly enhance disease detection and monitoring by providing clinicians with an additional diagnostic tool to complement standard skin examination and bacterial testing. I really want to recognize Chima for introducing me to this wonderful global group, and now this pilot program, we're working on it, Governor, and it's just really game-changing. Our administration, led by, of course, our wonderful governor, Lourdes Leon Guerrero, and Joshua F. Tenorio, our lieutenant governor, together with the Department of Public Health and Social Service leadership and staff, and all our stakeholders today, support Leprosy Awareness Month and World Leprosy Day. This support demonstrates our commitment to achieving the main goals of our Leprosy Strategy 2021 to 2030. Reducing and eliminating the spread of leprosy, preventing new cases, limiting the introduction of leprosy into Guam, providing proper care for those affected, and increasing awareness campaigns in our community. Thank you so much, and God bless.
Thank you, Director Ed. This time we'll recognize Ms. Catherine P. Ankow, Chief Public Health Officer, Division of Public Health, DPHSS.
Thank you, Senator. Good afternoon, everyone. On behalf of our two survivors, I extend their apologies for unable to make it today. We have invited them, but because of the time changed. So half a day, Governor, Director Teresa C. Ariola, Deputy Director Amanda Shelton, our partners from Guam Memorial Hospital, Guam Department of Education, stakeholders, and members of the community. We gather today to mark January as World Leprosy Awareness Month and January 25, 2026 as World Leprosy Day. This year's theme is Leprosy is Curable. The real challenge is stigma, as said by our director. This aligns with one of the 4 pillars of our global partnership for zero leprosy strategy, which is combating stigma and ensuring human rights are respected. This 2026, we focus on ending discrimination and promoting social inclusion for those affected by this treatable disease. For over 2,000 years, leprosy, also known as Hansen's disease, has been misunderstood, feared, and stigmatized. It is one of the oldest recorded diseases in human history, yet it's 2026, it remains a neglected disease, continuing to affect hundreds of thousands of people every year. Guam's current leprosy profile for Hansen's disease, we have an incident rate of 11 per 10,000 population. Guam leprosy case from 2011 to 2025, 175 cases with 11 new cases identified in 2020 last year. Most leprosy patients are aged between 15 and 44 years old, mostly males and non-US born. Today, we are here to say leprosy is curable. The real challenge is stigma. Science has won the battle against the Mycobacterium leprae bacteria. Multi-drug therapy is highly effective, safe, and provided free by World Health Organization and its partner. A person is no longer infectious just a few days after treatment. So why does this disease still persist? It persists because of fear. It persists because of outdated beliefs that led to isolation, discrimination, and the loss of livelihood and education for those affected. It persists because people are afraid to seek early diagnosis, fearing that they will be cast out of their communities. In 2026, we must act with compassion. Let's work together to break down the walls of prejudice. Treat every individual affected by leprosy with dignity, respect, and equality. Let us raise awareness. We must educate our communities that leprosy is not a curse. It is not highly contagious and it is curable. Ensure that early detection by moving the stigma, we encourage early diagnosis, which prevents permanent disability and interrupts transmission. As we look to the future, a future where we can eliminate leprosy transmission completely by 2023, as long as Chima is here, we must remember that we are dealing with a human rights issue. Let us commit today to support the mental well-being of those affected and work to integrate them fully into society. Today, we can unite, act, and eliminate. Together, we can create a world where leprosy is a disease of the past and dignity is the reality of the present. Thank you.
Thank you. And at this time, we're going to redirect our attention towards the TV to my right. Senator Shelton, if you could just turn around real quick, Gov. Sorry about that inconvenience. Mace.
Honorable Governor, Lieutenant Governor, Senators, and my dear colleagues in it is a matter of great honor and pleasure for me to be speaking with all you on the occasion of 2026 World Leprosy Day and Proclamation signing of law. My name is Dr. Devta, and I'm the team leader of the Government's Global Leprosy Program. The Global Leprosy Program provides technical support through evidence-based guidance, monitors the leprosy program globally, and brings stakeholders together, providing an overall leadership to the program. The current global leprosy strategy sets out to challenge and change the existing paradigm of leprosy and steps to move it beyond mere control of disease to achieving elimination of leprosy. This is defined as no new autochthonous cases of leprosy as a result of introduction and transmission. Contact screening, along with single-dose rifampicin as post-exposure prophylaxis, has shown promising results and could be a potential game changer. The signing of the proclamation is a testimony to the political commitment to resolve the problem to work towards elimination of leprosy. Such initiatives provide opportunities to create awareness in the community that leprosy is a curable disease through multi-drug therapy. It's a preventable disease through chemoprophylaxis, and a disease which is amenable to elimination, where there is no place for stigma and discrimination in society. I take this opportunity to congratulate the Tuberculosis Enhanced Disease Control Program of the Bureau of Communicable Disease Control on your leadership on such important initiatives. Ladies and gentlemen, these opportunities invite us to review our commitments and to revitalize our efforts. Strong surveillance systems and a strengthened partnership of national programs, persons affected by leprosy, civil society organizations, and the WHO are crucial in path towards interruption of transmission and ultimate elimination of leprosy disease. Last year, I had an opportunity to visit your beautiful country on my way to my friends. I look forward to greater opportunities for closer engagement with your country and on behalf of the Global Leprosy Program of the WHO, assure you of the support. Thank you.
Good morning, and thank you very much for the kind invitation. My name is Dr. Kazim Sadipullah, and I serve as the technical lead for leprosy and other neglected tropical diseases in WHO's Regional Office for the Western Pacific, based in Manila, Philippines. I'm a medical doctor by training with a master's degree in public health from the George Washington University in Washington, D.C. I'm truly honored to join you virtually for this very important occasion, marking Leprosy Awareness Month and World Leprosy Day Proclamation signing, and to express WHO's strong support for Guam's efforts towards zero leprosy. WHO's regional office works with countries and territories across the Western Pacific region to prevent, detect, and eliminate communicable diseases, particularly those that disproportionately affect vulnerable and hard-to-reach populations. One such disease is leprosy, an ancient disease that is entirely curable, yet still carries unnecessary stigma and discrimination. Globally, WHO is committed to achieving zero leprosy, zero transmission, zero disability, and zero stigma. In line with this commitment, we at the Western Pacific Regional Office of WHO support countries by strengthening early case detection, ensuring uninterrupted access to multi-drug therapy for leprosy, integrated leprosy services into primary health care, strengthening prevention, including chemoprophylaxis with a single dose of rifampicin, and promoting approaches that protect dignity of those affected by leprosy. Since the adoption of the World Health Assembly resolution in 1991, progress in the Western Pacific region, including Guam, has really been substantial. Prevalence of leprosy in the region sharply declined from approximately 68,000 cases in 1981 to only 7,000 cases in 2018. This remarkable reduction was mainly driven by increased implementation of multi-drug therapy in this period. The goal now is to entirely and completely interrupt the transmission of this ancient disease. I would like to commend the government of Guam, the Department of Public Health and Social Services, the Tuberculosis and Hansen Disease Control Program, and all the frontline health workers for your sustained commitment. Your work reflects leadership, compassion, and a strong public health system that leaves no one behind. As you mark World Leprosy Day and Awareness Month, please know that WHO stands with you in your efforts to support surveillance, strengthen capacity, reduce stigma, and move steadily towards elimination of the leprosy disease. Let us continue working together so that leprosy not just becomes a disease of the past, but a reminder of what strong public health action and solidarity can achieve. I thank you very much, and I wish you all a very meaningful and successful observance.
Executive of the International Federation of Anti-Leprosy Associations, or HOLE. Our offices in Switzerland, or I'm personally based in New Zealand. We're a federation with 15 international NGOs with achieved our goal, the vision of the world free from leprosy. Essentially, ILEP members are hands-on organisations. That is to say, we move on the ground in about 50 countries, supporting governments in their programs towards WHO's 2030 goal for leprosy, which is interruption of transmission of the disease, leading on to disease elimination, that is to say, no new cases. We are also involved in building program capacity in research, especially through the Leprosy Research Initiative, in supporting the flourishing of people's organisations advocating for leprosy, in combating abuse of human rights of persons affected by leprosy, and much more. It is also one of the founding partners and 4 funders of the Global Partnership for Zero Leprosy, which provided tools and some long-term logistic support towards grants and zero leprosy growth. Is leprosy elimination possible? Well, in terms of global disease, yes, it is. The tools are there, especially the rapid follow-up of any new cases, so that people are put onto immediate treatment. Contacts are examined and encouraged to take a single dose of the drug rifamycin to help prevent the disease. We've seen in the case of island states like the Maldives that a combination of political commitment, good public education, trained staff, and quick response to new cases have brought an end to child cases in that country, and we expect to see soon an end to adult cases as well. But that's not enough to get to a world free from leprosy. We are constantly reminded by people with lived experience of the disease that prompt diagnosis and treatment usually result in a physical cure, but the psychological and social consequences of leprosy can be very damaging. As a result, ILEP's theme for World Leprosy Day 2026 is leprosy is curable, but the real challenge is stigma. In Guam, you adopted your own zero leprosy roadmap action plan around about a year ago. You've shown intent to work towards the goal of zero transmission, zero new disability from leprosy, and zero sexual discrimination. As with all strategies, the challenge is implementation. I encourage you to allocate the resources that are needed to move through the action steps to strive for the zero leprosy roadmap. This World Leprosy Day, it's great that you're giving attention to the problems around the community awareness, which are part of many countries and territories like Guam, especially as we face the difficulties forward. I congratulate you on a well planned World Leprosy Day and Awareness Month, and I wish you the very best for successful continuation of the program. Thank you.
My name is Dr. Kapoor, and I'm the Deputy Director of the Global Partnership for Leprosy. It is a privilege to join you on this important occasion dedicated to awareness, solidarity, and action. As you presented, our vision is clear and unwavering: a leprosy-free world, a world with no defeat, no dignity, and no stigma or discrimination. This vision is strongly reflected in this year's theme. Leprosy is curable, the real challenge is stigma and discrimination. This theme reminds us that while effective treatment for leprosy has been available for decades, many people still face fear, exclusion, delayed diagnosis, and lifelong consequences. Not because of the disease itself, but because of misinformation and social media. Addressing these challenges require not only medical solutions, but also compassion, education, and inclusion. The Global Partnership for Zero Leprosy was established in 2018 as a global multi-stakeholder platform. Since then, we have worked to unite governments, international agencies, researchers, donors, civil society organizations, and most importantly, persons affected by cancer disease. Our work is guided by 4 strategic pillars: research to generate evidence that strengthens early diagnosis, prevention, and treatment; policy to support countries in developing and implementing strong, integrated national leprosy strategies; partnership to align efforts and resources across sectors; and prioritizing people, ensuring that persons affected by leprosy are at the center of all programs and decisions. Globally, our efforts focus on accelerating impact in high-burden settings while supporting low-burden areas to sustain achievements and prevent re-emergence. We believe that ending leprosy is not only a public health goal, but also a matter of human rights, dignity, and social justice. To the people of Guam, I would like to commend your commitment to awareness raising, educate people, and community engagement. Your efforts during leprosy awareness month help break myths, reduce fear, and ensure that no one is left behind. As we mark for Leprosy Day, let us reaffirm our shared commitment to detect early, to treat promptly, to prevent disability, and to eliminate stigma and discrimination in all its forms. The Global Partnership for Civil Leprosy stands with ON and with communities around the world in this collective journey. Together, through collaboration and compassion, a leprosy-free world is not just an aspiration, it is achievable. Thank you, and I wish you a meaningful World Leprosy Day and awareness.
Hello everyone. Welcome to all. My name is Amal Kumalsina, also the group experience of cancer disease, currently serving as the global network coordinator of IDEA. It is great honor for me to share this message with you as we observe further this day and look to see awareness. I stand as a living example to the world that any person, whether neglected, ignored, stigmatized, or isolated by society, can rise with respect and dignity, not only for themselves, but also for others from same community. I faced extremely difficult circumstances after being diagnosed with leprosy in early childhood. Today, however, I proudly identify as a person with lived experience of cancer disease, not only in Nepal, but around the world. This journey has been possible because of my strong commitment and dedication to upholding human rights and dignity. I am delighted to share that through consistency, self-belief, and perseverance, I have regained the dignity that was once taken from me. I appreciate the leadership and dedication in raising awareness and standing in solidarity with people affected by leprosy or cancer disease. I believe your efforts will truly make a difference like mine. IDEA is an international organization primarily focused on serving humanity and a global network committed to promoting human dignity, inclusion, and equal rights, especially for people affected by leprosy and other entities. Our main work focuses on fighting stigma and discrimination, promoting social inclusion, supporting health awareness and early diagnosis, strengthening community leadership, advocating for human rights and justice. We work closely with organizations of persons affected by cancer disease and other entities, government bodies, faith leaders, and international partners to ensure that people affected by leprosy are not left behind. We gather virtually every month to share knowledge, experiences, and expertise through Zoom meetings. Participants from more than 35 countries come together on the same platform to learn from one another, to share one another. At IDEA International, we believe that no one should be excluded because of a disease. Every person deserves respect, opportunity, and hope. We believe nothing about us without us. IDEA International supports countries in achieving zero leprosy through awareness and education. We promote awareness and accurate information about leprosy so people understand that it is curable and not a curse. Community empowerment. We support people affected by leprosy to become leaders, advocates, and role models in their own communities. Stigma reduction. Through campaigns, dialogues, and partnerships, we work to remove fear, myths, and discrimination. Policy advocacy. We engage with governments to ensure inclusive laws and policies for people affected by leprosy. Global collaboration. We connect organizations across countries to share experiences, solutions, and best practices. Zero leprosy is not just about eliminating the disease. It is also about eliminating stigma, exclusion, and inequality. Our efforts and plans to address leprosy globally. In my role as Global Network Coordinator, I focus on strengthening international partnership, supporting community-led initiatives, encouraging youth and faith-based involvement, promoting cross-country learning, amplifying the voices of people affected by leprosy. We aim to build a world where leprosy is detected early, treatment is accessible, equal. No one faces discrimination. Communities are informed and compassionate. Together, we can transform awareness into action and action into impact. To our brothers and sisters in Guam, I want to express my heartfelt appreciation for your commitment to World Leprosy Day and Awareness Month. Dear brothers and sisters, your efforts in raising awareness, educating communities, and standing with those affected by leprosy are truly inspiring. Please remember, dear brothers and sisters, leprosy is curable, stigma is preventable, compassion is powerful. Our voice brings hope, our action brings change, and our unity brings healing. Let us continue working together towards zero leprosy, zero discrimination, and zero exposure. Finally, I would like to thank Brother Chima for approaching me with the proposal of sharing my experience and remarks. I believe that Brother Chima's leadership and dedication has made a huge difference among the community here in Goa. May your work continue to serve in the field of humanity for many years to come. Once again, thank you so much, my dear brothers and sisters. All the best.
Thank you so much to our international partners for those great remarks. At this time, I'd like to recognize the Honorable Governor Lourdes A. Leongro, Governor of Guam.
Thank you very much, Roy. Welcome to the signing of this proclamation, as you've heard from very, I think, prestigious world leaders on global leprosy program, and also from someone who himself had leprosy. Those words are so very meaningful. And as I listened to them, I was very impressed that we are connected in the world for this disease. But we are connected not just for this disease, we're connected for other diseases. And so for me, as I was thinking about, the stigma of leprosy, I can't help but think back about the stigma of AIDS, HIV, even tuberculosis. When I was growing up as a little girl, when my grandfather had tuberculosis and he had to be isolated, he had his own plate and cup, and the public health nurse will come to make sure that those are being controlled, right? But you're right, we are right, that this is all just because of misinformation. But not only that, I think at the time that the diseases are, that's what was known. Just like when we had COVID, we didn't know much about COVID, but we kind of used our common sense on how we could prevent it, right? So I'm just thinking at that time with tuberculosis, that's sort of the same kind of thinking. But as we advance in technology and research and science, we learn more, and now we're at a point where we do really still have to fight the stigma and educate our people. And when I was listening to the global world experts, I can't help but think, thank you for their support. But really, the hard work begins locally. And it's at our local level that we do the hard work to bring out the communication, to bring out the education, to tell people what are the signs and symptoms that we need to look out for so that we can come real quickly to be treated, right? This is the job that public health does. And I am very appreciative for all the work that you guys do, and all the things that you sacrifice to do, even in the light of limited resources. But we still become very creative and innovative to move forward. So I want to thank the leadership, Therese, and of course Amanda, Peter John, and all the division heads and all the people that lead the programs who have reached out not just to our community regionally, locally, but also to the world. So that's how we fight this. We fight this together in one united voice and an advocacy of strength and courage. So thank you again.
although January is going to be declared as the leprosy month, and also Sunday, January 25th, recognizing World Leprosy Day. What this does is it just makes us able to have more access to the community to continue our education. But it really shouldn't just be a month or a day. It should be a continual. And I'm pretty sure it is continual for you guys. So thank you for all your work. And believe me, whatever we can do as an administration, we are right there alongside with each and every one of you. We have to, from government leaders to private sector leaders to NGOs to nonprofit organizations. We all need to be together on this very, I think, first global strategy, and also the urine test, right? Our first again. Guam is always first. We were the first to get 92% vaccination with COVID. And so we actually I believe that the reason we are is because we have very passionate, committed workers on the ground to make it happen for the good of our people and for the health of our islands. So thank you, and Sidus Masi, and Biba Public Health.
Thank you so much, Governor. At this time, I would like to recognize Matthew Braganza, Communicable Disease Coordinator.
Hello. Good afternoon, everyone. Thank you for coming here. Thank you for, our governor for making it despite of her busy schedule, and our director, public health director, Therese Ariola, and deputy director, Amanda Shelton, and everybody who made it here. Proclamation number 2026-06. A proclamation of the governor proclaiming January 2026 as World Leprosy Month and Sunday, January 25, 2026 as World Leprosy Day. Whereas Gerard Henrik Armauer Hansen, a Norwegian scientist, discovered Mycobacterium leprae as the causative organism for leprosy, defying the hereditary affliction theory of the disease in an article he published in 1873. And whereas leprosy is often viewed as an ancient, eradicated disease, yet hundreds of thousands of new cases are diagnosed each year among children, women, and men. Leprosy is curable, and early detection and completion of prescribed treatment can prevent suffering and disability. And whereas, according to the Centers for Disease Control and Prevention, which is CDC, Hansen's disease is caused by slow-growing bacterium called Mycobacterium leprae and Mycobacterium lepromatosis. The disease can affect the nerves, skin, eyes, and lining of the nose. After contact with the bacteria, it may take several months to up to 20 years for someone to develop signs of the disease. And whereas each year, according to the CDC, up to 225 people in the United States and 250,000 around the world are diagnosed with Hansen's disease. And 175 new cases of Hansen's disease were reported in Guam from 2011 to 2025, with 11 new cases identified in 2025. And whereas, according to the World Health Organization, early diagnosis and treatment are effective. The World Health Organization recommends contact tracing and administering a single dose of rifampicin to contacts to prevent the disease. Current leprosy elimination efforts focus on reducing stigma and discrimination, engaging affected individuals, building stakeholder and partnerships, and strengthening national leadership. And whereas the theme for World Leprosy Day 2026 is Leprosy is Curable. The real challenge is stigma. This theme encourages everyone to learn more about leprosy, understand the difficulties faced by those affected, and work together to help end the disease. And whereas World Leprosy Day raises awareness of leprosy-related stigma and highlights the needs of those most affected. By working together in Guam, we can help prevent the spread of the disease and reduce discrimination against individuals and families affected by leprosy. And whereas we call on government and community leaders to join forces and make leprosy prevention a top priority in Guam. We invite increased investment in the years ahead to help realize this vision. We also welcome partnerships with community leaders and stakeholders to weave leprosy awareness into their teachings and community resources.
Now, therefore, I, Lourdes A. Leon Guerrero, Magahagan Guahan, Governor of Guam, by virtue of the authority vested in me by the Organic Act of Guam as amended, do hereby proclaim January 2026 as World Leprosy Month and Sunday, January 25, 2026 as World Leprosy Day. In witness whereof, and together with the Segundo Magalahinguahan Josh Tenorio, we have caused the Great Seal of Guam to be affixed in the capital village of Agutnia on this 23rd day of January in the year of our Lord, Anno Domini 2026. Biba!
This concludes the proclamation for January 2026 as World Leprosy Month and Sunday, January 2026 as World Leprosy Day. Ladies and gentlemen, if you could please join me up here behind the governor and the director for a quick photo op, we'd appreciate it. Thank you.